Welcome back! In this video, we will be discussing the topic of depression. What it is, what are the symptoms, the anatomy and neurochemistry of depression, the statistics, and its treatment. But first, what is depression? Depression is a mental health disorder that consists of emotions of overwhelming sadness, irritability, and lack of motivation and self-esteem. Depression is distinctive from regular unhappiness as it typically persists over a long period of time or in sporadic waves of unexplained sadness. Because of this, depression often affects concentration as well as relationships with oneself and others. Now, what are the symptoms? Symptoms can range from changes in mood, behavior, physiology, and cognitive function. Changes in mood can be represented by lack of interest or pleasure, stress, and constant sadness. Changes in behavior can consist of social isolation and agitation. Changes in physiology can be demonstrated through fatigue as well as significant weight loss or gain. And lastly, changes in cognition, also known as our ability to mentally understand and process things, include lack of concentration and negative or suicidal thoughts. According to the American Psychiatric Association, also known as APA, in order to be diagnosed, a person must be experiencing 5 or more symptoms during the same 2-week period, and at least one of the symptoms should be either depressed mood or loss of interest or pleasure. Now let's move on to our next topic about the anatomy and neurochemistry of depression. When looking at the anatomy or physical structure of the brain, patterns observed in patients with depression are smaller frontal lobes and smaller hippocampi, which are both crucial for our cognition and emotional expression. Moving on to its neurochemistry, neurotransmitters are chemicals that carry messages between neurons and can affect mood and behavior. Low levels of neurotransmitters can disrupt proper signaling to the brain regions involved in emotional processing. The limbic system of the brain, for example, consists of such structures responsible for this. Briefly, they include the amygdala, hippocampus, hypothalamus, and thalamus, which you can further explore in our other videos, such as our lobes and neuron videos. Therefore, lack of stimulation in these areas may result in depression. More specifically, a decrease in the neurotransmitters serotonin, norepinephrine, and dopamine can lead to depression. Now let's look at the statistics of depression. Globally, more than 264 million people suffer from depression. Depression is the #1 cause of disability worldwide. Twice as many women are affected than men. 2/3 of people suffering do not actively seek help. And lastly, depression is the cause of over 2/3 of the 30,000 reported suicides in the US each year. Last but not least, let's discuss treatment for depression. Unfortunately, there is no cure or finalized understanding of when depression will arise. However, various types of medication and therapy can be used to alleviate and lessen its symptoms. Antidepressants, for example, can help rebalance neurotransmitters in order for the brain to function properly. Selective serotonin reuptake inhibitors, also known as SSRIs, are a type of antidepressant that prevents the reuptake of serotonin and allows serotonin levels to be maintained for a longer period of time in patients with low levels. Now, let's take a closer look at how SSRIs work. Here, we have a patient with normal levels of serotonin, which is represented by the larger number of dots. These dots are being released from vesicles in one neuron to the next neuron and taken up to be reused. However, in patients with low levels of serotonin, there is much less serotonin in the vesicles, which means lower amounts will be sent to the next nerve cell, and thus less stimulation is occurring. And this causes depression. Here, with the SSRIs, the patient has the same, if not a larger amount of serotonin being sent to the next nerve cell compared to those in normal patients. The pink blocks represents the SSRIs physically blocking the reuptake of serotonin. In addition to medication, psychotherapy also helps by allowing patients to express their thoughts in a safe environment with a mental health professional in order to better understand how to deal with their symptoms and behavior. Sometimes depression can be confused with a little sadness. On the other hand, it is important to address these feelings and not overlook them. Regardless of your situation, there are several resources to visit that can answer any questions you may have about the subject of your own mental health.